Let me present today's speaker, Dr. Neil Baum, who is a practicing physician in New Orleans, and he is a professor of clinical urology at Tulane Medical School. He's written quite a few books, 7 total, and his most recent publication is entitled The Complete Business Guide to a Successful Medical Practice. I thoroughly recommend it. And Dr. Oz has even endorsed his latest book, which is his last book, which is titled What's Going On Down There? The Guide to Women's Pelvic Health. He's written over 1,000 articles in more than 200 publications that have appeared in peer-reviewed journals in the United States and Europe, and he and I have co-authored a couple of pieces. I'm honored to be associated with such a distinguished author. But he's also a very highly requested speaker to medical practices, physician groups, and medical organizations throughout the country on topics to help doctors and practices improve their efficiency and ultimately their productivity. He's a terrific leader, business visionary, marketer, and an excellent clinician. So thank you very much for being here, Dr. Baum. We're excited to hear your presentation, and at this point, I'll let you take it away.
Thank you, Ron. My title of my talk is Creating the Almost Perfect Medical Practice. I don't want to be on the other end of the line and appear so audacious and bold as to tell you that I have a perfect medical practice, but I strive to have one, and I think I know all the ingredients that are required to have an ideal medical practice. The next 3 slides are what are the hallmarks of an ideal medical practice, and I'm not going to read those for you, and I'm going to make the slides available to you, but you can see that these are things that we all should be striving for, and this is on slide number 3, and slide number 4, again, refers to things that you want to have, such as no legal issues, no problems with malpractice, and you want to have an online reputation management that is minimum 4 to 5 stars. And slide number 5, I will point out to you that you want to make sure that you have emails answered to your patients in a timely fashion, either by the doctor or someone on the staff. And then it's the last thing that I want to spend and focus on this afternoon, and that is that you have a practice brand. So what do I want to accomplish in the next 30 minutes? Slide number 6, I hope to be able to define the concept of branding. I want to show the importance of branding. I'm going to give you some examples of branding from my practice and also examples how to start branding. And then I'm going to give you some return on the investment. What does branding mean for you and your practice? Slide number 7 I refer to as my rule of 72, and I believe strongly if you have a plan or an idea and you don't take action on it in 3 days or 72 hours, chances are you never will. And at the end, I'm going to mention to you the importance of the rule of 72. So since this is almost Thursday, let's say by Monday, I hope each of you will find something valuable and useful in this presentation, that you will take action on it and implement it by sometime next Monday. Let's begin with slide number 8, branding, and what is the definition of branding and what does it mean? If you were to, it comes from the concept of branding cattle, and if you were to brand your cattle on a ranch, you want to make your cattle look different from all the other cattle on the range, even if all the cattle look the same. And the same applies to a medical practice. You want to make your practice look distinguished, look outstanding, and look different than all the other practices in the community, the region, and possibly in the nation. The next slide, slide number 9, is that you want to create the perception that you and your practice is superior The people who come to your practices are going to have an outstanding medical experience when they come to the practice. And in order to do this, you have to create a brand. And I'd like to share with you how that is done. The goals of branding are shown in slide number 10. And that is, if you ask anyone, any practice, multi-specialty group practice all the way to a solo practitioner, everyone will tell you, oh, my practice is special, it's unique, and we offer absolutely the best health care. And if you ask those same people, how do you know all that? And they only can tell you that they feel it in their bones and in their gut that they have the best medical practice, but they clearly haven't demonstrated. But what does branding do? Branding demonstrates your uniqueness and actually proves by documentation your superiority. And branding allows you to sculpt the ideal medical practice, to have exactly the kind of patients that you want in your practice. To show you how effective branding is, look at the right of the slide is the Evian bottle. Evian is water. Probably doesn't taste any different than tap water. Tap water is free, and Evian charges about $1.50 a bottle. And people are paying millions and millions of dollars for Evian water when what they can get out of the tap for free. That shows you the power of branding, that you can make people pay for water that they could easily get for free out of the tap. So how do you get started? Slide number 11. You want to find out if you and your practice are best at treating a specific disease or condition. If you have a surgeon that's in the community or a medical practice in the community that treats conditions that nobody else can do, that makes you a superstar, and that can easily be branded. If you have an area of interest and expertise, or if there is an unmet need in the marketplace, and you can call that to the attention of your existing patients as well as other potential patients, now you have something that you can brand. So what can the practice brand? Slide number 12. You can brand multiple languages if you speak those languages, or people in your office can speak those languages. If you can evaluate a patient on a single appointment, that is very attractive to patients. If you conduct online consultations or telemedicine, which is now on the horizon, that's attractive. I'm going to talk to you about shared medical appointments. I'm going to talk to you about same-day appointments in just a few moments and show you how that was branded in my practice. So how to get started? The way to get started in branding your practice is to think like the patient does. Where does the patient usually have their first interaction with the practice? It is usually on the telephone. Slide number 14 shows that the telephone is equal to an opportunity. It's your opportunity to create a positive first impression on the patient. There's a wonderful book that I highly recommend called Own the Phone. It's available from Green Branch Publishing by Spencer Peller, and I recommend that if you feel your telephone skills or the skills of your receptionist are not up to speed, I highly recommend this book. Slide number 16 shows the importance of branding by interacting with the patient before they come to the practice. This usually can begin with your website, and we'll talk a little bit more about the website and its role in branding. You want to tell the patient what to expect on their first visit. I'm a urologist. Every patient is told that they are expected expected to give a urine specimen at the time of their first visit, so they don't say they just went before they came, and now you have to hydrate them, and they can spend an extra 15 or 20 minutes in the office because we didn't tell them what to expect. We also tell them to bring a copy of all of their studies and lab reports. We want a list of all of their medications, preferably if they would be written out, including their over-the-counter medications, and not to bring a plastic bag full of their medications, as this takes a lot of staff time to log that into the computer. I also recommend that you avoid the word waiting with patients. It's not a waiting room, it's a reception area. And you want to start having the patient experience your practice the moment they open the door. You don't want it to look like, on the left, like a bus station or a train station. You want it to look more like on the right, where it is more like a living room, and it's where the patients can sit and relax until they are received. So make every effort to avoid the word waiting room. Be polite. Don't tell patients to turn off the cell phones in the office. Request instead that they turn off the cell phone as soon as the doctor or the nurse enters the room, and then thank them. This is far more polite as to tell them to turn off the cell phones, as they're not likely to do it. But the other, where you're kind and have a nice note in the reception area as well as the exam room, they are likely to comply and turn off the phone or quit their phone call as soon as the doctor enters the room. Scheduling is very important, and I'm going to talk to you about same-day appointments. I think slide number 23 shows how to conduct a time and motion study. Essentially, you want to see how long, and we do this twice a year, you want to see how long the patient's in the office and how long they spent with the physician. If the patient is in the office 60, 90 minutes and spend less than 5 minutes with the patient, you are not going to be giving that patient an optimal medical experience. I recommend that you create slide number 24, Sacred Time. This is a 15-minute slot, end of morning, mid-afternoon, where any urgencies or emergencies are told to come in during this opening that you have that can't be opened until the day that the patient calls. In other words, they couldn't open up the Sacred Time this morning until we went off the answering service at 9 o'clock in the morning. Then they can start filling in urgencies and emergencies. Slide number 25 shows you the concept of how you can stay on schedule, and it's my experience with using Sacred Time that the patients beforehand were waiting 40 minutes. Now we got it down that it is usually less than 10 minutes because we are having them complete their demographic, insurance information, and health questionnaire before they come to the practice, as they can download this from the website. One of the things in order to brand your practice is you want us to see patients on time. The number one complaint patients have about their experience with their physician is excessive waiting, and there's really very few excuses today that prevent us from being much more sensitive and respecting the patient's time. There are ways to manage delays. You can anticipate them and call in the office and let them know that you are late. You can offer the patient a coupon to get a cup of coffee and see them at the end of the day. Slide number 28, you can even call the patient at home. You should send an automatic apology letter if the patient has been made to wait a significant period of time. I'll talk with you during the Q&A session about not charging patients made to wait. The take-home message I want to emphasize to you is that few of us can change the healthcare policy, but every one of us, there are really no exceptions, can be much more sensitive to the patient's time. In order to give that patient a positive experience, offer them amenities. We offer free Wi-Fi in the reception area and in the exam room. Slide number 32 shows that if it is cold and the patient has to get undressed, we offer blankets and heaters in the room to make them comfortable. For seniors, we have reading glasses that we make available both in the reception area and in the exam room. We also, slide number 34, provide them with websites, particularly websites for the elderly, because we want to direct them to what I refer to as credible websites. Every patient who comes to the office in slide number 35 gets a wallet medication card that they are to put in their wallet and list all of their medications and their prescriber, and it also has the name of our practice. In our practice, we want to emphasize wellness as much as illness, and every patient adult patient receives a testicular self-exam, and on the reverse side for women is a breast self-exam, and that is given to every patient to remind them of the importance for men testicle self-exam and women breast self-exam. We want to give them value-added services for those who are older Americans and can't afford medication. We give them websites and telephone numbers where they can get their medication at either no expense or at a much reduced expense. We also show our brand on our newsletter that is sent out quarterly to all the patients. We collect email addresses, and we are keeping in front of our patients on a repeat basis in order to brand our practice. If you're asking me the best idea for branding the patient experience after the patient is in the practice, it always comes to calling your key patients at home. The key patients are patients shown on slide 42 who've had an outpatient study or a procedure, or patients recently discharged from the hospital who you know have questions about their medications, their dressing, and when they should have a follow-up appointment. The nurse or the medical assistant calls the key patients at home. They call them at the end of the afternoon. Sometimes they are able to usually answer 95% of all the questions that are asked. Occasionally they have one that the doctor needs to answer, and these patients are told that I will be calling on my drive time home and told to leave the phone line free, at which time I will call and answer their questions. The results of calling your key patients at home is that you'll get fewer calls from your patients, and it is so very appreciated. A response from a key patient is shown in the next slide, where the patient said, "This is the first time a member of your profession has taken the time to call me at home and check on my condition. Undoubtedly, it fosters a better relationship between you and I. Now we know we have branded our practice."